this is a good one, and it's whether or not you should have a facelift when you're in your 40s. And so this story actually comes from a news article that came out this past week about Catt Sadler.
Okay.
Do you know her?
She looks familiar.
Yeah, she does. I recognized her when I saw her. I'm not sure I could have come up with her name. She's 48 years old.
Okay.
She's a TV host, or former TV host, e-reporter, podcaster, entrepreneur.
She's from E! News?
Yeah, she was a reporter for E! News.
Okay, yeah, that's where I remember her from.
So this past week, she came out saying that she'd had a facelift, neck lift, and eye lift. So 3 procedures. And the reason that this is a story is because, jumping ahead a little bit, these are typically procedures that are done on people older than 40. And we'll kind of dive into that. And so she was very open about it, which I think is super cool. Because I don't like when celebrities are, going around having plastic surgery and say, oh, this is all natural, when it's really not.
Yeah.
So she had a really good quote, and pardon my French, but I'm going to quote her directly. She said, "Of course, I thought, what are people going to think? Who is going to judge me? But I think one of the best parts about getting older is giving 0 fucks about what people think." And I was like, that's really, really well said. I agree with that 100%. But the big question is, I guess, what do I think about someone getting a facelift in their 40s? So I guess the first question you have to ask is, when do most people get facelifts? And so I actually tried to pull some data on that, and it was kind of over the map as far as when do people normally get facelifts. But it does seem to be that early 60s is kind of the average.
Okay.
There are definitely people getting facelifts in their 50s, not a ton. There's a lot of people in their 60s, some in their 70s. And so, the question is the 40s too young? Well, and I'm a pretty conservative surgeon. I know we've talked about this in the past, that I am absolutely not afraid to tell people no if I think they don't need surgery. Like right off the bat, my first inclination is to say that 48 is too young to have a facelift and neck lift. And the eyelids are a little bit different. Now I'm gonna mention about that at the very end. Travis, can you pull up that next picture? I think it's just a close-up of her face. Yeah. So
is this before?
This is the before, right? So when you look at her, I will say that, and this is probably just purely genetics, that it does seem that she does have a little bit more sag to her face than might be average for someone that's 48.
Yeah, maybe right here.
Yeah, a little bit of jowling there, even the mid-face a little bit. And I'm going to show another picture in a minute, not a second, of her eyes. And so, the question that I have for somebody that maybe is young, seeking a procedure that's normally done on patients who are older is, does this patient have a circumstance where they are aging more quickly than normal? And so, that is a reason where I would probably, I might consider doing it myself. And so when I look at her, she's a beautiful woman, but, I do think that the aging of her face is a little bit earlier than it might be.
You could see why she wants to get
I could see why she wants it. And so I would tell you that, if she had come into my office, I would have probably tried to convince her to do a non-surgical treatment. Nowadays, there are amazing treatments for the face and neck to make them look more youthful that are non-surgical. And in the past, that wasn't always the case. The technology has definitely gotten better in the past few decades versus, in the more distant past. So we use lasers. I like the Halo, the Cyton Halo laser. Actually, that's the one I use on myself and my wife. That thing absolutely works very nicely.
Yeah. What age should you start using that at?
Well, my 30s. It depends. If you want to prevent your face from ever starting to sag, and there are women that use it in their 30s.
How much does the basic package
for you or for the average person?
For the average person. I'm asking questions because I'm like,
yeah.
If you're in your 30s and you're thinking about it.
The Halo specifically, which is, so the Halo is a very aggressive laser. It's not so aggressive like your whole face is going to fall off, but there is about 5 days of downtime. And it does a really, really good job. And it runs about roughly $1,000 for a treatment. But I do love it. Of all the machines in my office, it's the one I use on myself. I do like it. And so that type of machine, the other one I like is Morpheus, which is microneedling and radiofrequency energy tightened skin. Those machines were made for people like her. They're a little bit early in the game. It's not like their whole face is sagging off. And the reason that those procedures are nice is because you're going to get a result out of them, but if you try to use them when you're too far along, you'll be disappointed. And so I think that she's kind of a classic example of somebody that very likely could have gotten a very, very nice result from a non-surgical treatment. However,
I wonder if she did get.
That's a great question of whether or not
and
she's
then,
done
like,
in the
she
past.
didn't like it.
You know, that's a brilliant question. I don't know. That wasn't mentioned in any of the articles I read as she tried non-surgical things. I would love to know. That's
because I feel if I was a celebrity and I heard somebody say, "Oh, it's only $1,000 to do lasers and stuff,"
Yeah.
I'd be like, "Oh, okay.
Let's do it.
Yeah.
Yeah.
And it works.
You know, that's a great question. And if in the case that she had done that and she didn't get the results she wanted, then it's a no-brainer. It's a no-brainer. Do the surgery. So yeah, if she'd come into my office, I would have tried to push her down the road. And I do this all the time. I get a lot of facelift, neck lift consults, and I'll say, look, you're a little early. Why don't you try this? See what kind of results you get. You might get a result that'll last you 5 years. If you get a result that lasts you 5 years that you don't have to have major surgery, do it. That's no brainer. And why is that, right? So I guess the question is, why am I trying to push people away from surgery? Well, for one, I always believe that you can get an equal result with non-surgical means. You should do that. You know, there are risks associated with surgery. It's not that there's no risk with these non-surgical treatments, but they're just less. And then secondly, if in the future you really, really need to have the surgery, it's much harder to do. I've done redo facelifts, and I don't like doing them. Like, the tissues are scarred up, the dissection sucks. I mean, it is a little bit more, I don't want to say stressful, but more tedious procedure. I do think the risks do go up. And so when you do something that young at, say, 48, you know, in 20 years from now, when she's 68, which is, you know, nowadays not old, there's plenty of very, very active 68-year-olds running around. I mean, she might need a surgery that then is going to be harder, you know, and if she could put it off a little bit, she might have avoided it. But you know, honestly, I do firmly believe that, you know, it's her body and her choice. I'm not going to dog her for, you know, there were people saying bad things about her, that, why did you do this at this age? Well, I mean, it's none of really your business. I mean, you know, I think when she saw a surgeon, she should have at the very least been offered some non-surgical treatments. But, you know, looking at her, at where she was with her face, if she had said, look, I understand that there's non-surgical things out there, but I really just want to do the surgery because I don't want to have to keep repeating this, I would have done it for her.
Yeah.
I do worry when people come in and they want something and it's super subtle. I think that she had enough. I mean, you even saw, you're like, yeah, okay, I can see what she's talking about. It wasn't like that you have to get a magnifying glass out to see exactly what it is she's talking about.
I mean, not that there's anything for her to be insecure about, but I could see her being
you can see,
on TV and people
exactly
like,
why she's asking.
Yeah,
for it.
like, oh, she's gotten older or something.
So in general,
on E-News or whatever.
I mean, in general, to answer the question, should you get a facelift in your 40s? I think that the base answer should probably be no for most people. That if you're in your 40s, there's a lot of great non-surgical ways to get the same result.
Yeah.
But there are people out there that might not be the right answer for them. And if they want to pursue surgery and they find someone they trust, then I think that's okay.
Yeah. I mean, people just age differently in general.
Yeah, totally. Absolutely.
If I don't wear makeup, I look like I don't know.
How old are you?
Very
Do you mind
young.
if I ask?
33.
33. I knew you were early 30s.
I'll be 34 this year.
You look great. All right, well.